So, Dr. Holt, let's answer some questions that people have brought up. And I do want to point out to folks, so a lot of the information that's here, we'll provide that to you as a feedback if you've registered. So don't worry about, can you watch it again? You can, and you can also pass it on to your friends. But Dr. Holt, let's take a look at some of these questions that have been asked. One is, I get one shot of sleep and then I'm up and can't wake and can't get back to sleep. How do I stay asleep? And this is related to another question is, if and when I wake up in the middle of the night, what can I take and what should I avoid? You had some pretty good comments on that, didn't you?
Yeah, well, that's a tough one, because if you start to doze off and then something causes an arousal, like a sleeping partner or a pet or a noise outside of the house, and you feel like that you wake up and can't get back to sleep, remember to get out of bed. Just know that, you're going to have to try again in a little bit.
Yeah, I think that's important. I think also, if you take a look at these, we put the routes of administration up here. If you take a look at the edibles, especially, I use chocolate, a little square of chocolate. People use gummies. They'll last for 4 to 10 hours. They may take 2 hours to work, but they'll help you stay asleep through the night. So the question is, what can I do to help me fall asleep right away? And I think we'll talk about that in a little bit, but also inhalation is a good route of administration, and also sublingual drops can help with that as well.
That one guy that asked the question didn't say what he tried. If he did try like inhalation or something like that, a vape pen, and did try already having an edible or something like that that would carry him through, and then it's time to like go see his primary care doctor. But if he didn't try, what we were bringing up, then he's got to try that.
Right. I think sometimes when I know that being the older male, I just get the opportunity to get up in the middle of the night and go to the bathroom. I usually take a couple of minutes and just relax for a few minutes. Just sit down, relax, think about wanting to fall asleep, giving myself some good thoughts, maybe think about some calming music, and helps me fall asleep that way. As far as products to take, again, if you're taking that gummy, don't take another one. I don't recommend that. But you may want to take a look at maybe an inhalation product or something like that can help you fall asleep or get back to sleep. Let's talk about the next question. It says, struggling with getting restful sleep. I'm only using disposable vapes and edibles. Can you recommend a dosage? Well, I think we ought to back up a little bit on that. If you're struggling for restful sleep, you talked a little bit about that in the webinar.
Just remember, individualized, and don't think about a dosage that will always work with you at that time. I mean, that's not the way to think about it.
Right. I think that one of the things is, if, again, it goes back to what you called that REM sleep. What you want to do is you want to be able to get that sleep, but you also want to be able to be in a mood where you're in a mode where your body is receptive to it. Now, vapes are good. They work, but they work only short term, 2 hours. Edibles are great. They'll last through the night. But in order to get that restful sleep, you may want to take a look at trying some tinctures. You may want to take a look at trying some sublingual drops. You may want to try even, it may sound crazy, but a topical. And the reason I say that is sometimes if I've been active during the day, I've been out walking, I do some martial arts, I practice martial arts. My knee gives me a little bit of a pain. I don't really notice it as a sharp pain, but it's something that's there. I know that if I can put some topical cream on it, it really gets rid of that particular little bit of an nagging pain and helps me fall back asleep. So you may want to take a look at that because really why you're waking up is something that your body is reacting to, and being able to just calm down, relax for a few minutes will be able to help you get back to sleep. You've seen that, haven't you, Dr. Holt?
Absolutely. The big thing to come away with it is to look and see if there's any other problems that are going on that could influence the way you get to sleep and stay asleep. So pain management is a big one. You never know. You say it was like, well, I don't feel pain when I feel asleep, but pain can still be there, can still be causing arousals, and that's what you should try to manage. And sometimes there's no way to know that, but if you feel tired during the day, don't know why, answered all the questions, that you could possibly do about medications and everything else, then it's time to talk to your primary care or a sleep medicine, consult.
Yeah. And again, we pointed out earlier, 1 out of every 3 people in the United States suffer from some sort of sleep disorder. So you're not doing something that's abnormal. I mean, this is something that is more abnormal than abnormal. The next question is one that really helps answer a question about a lot of sleep. I suffer from neuropathy and arthritis pain at night. Is CBN a good fit? CBN is a good fit, but I think a better fit is also to really pay attention to the terpene profile that you're going to be using. The terpene profile is, again, going back to using beta-caryophyllene. I would take a look at a product that has the linalool in it. It'll help quite a bit. Myrcene, naturally, that's there. Those kinds of terpenes in the product will also help you go to sleep. Now, there's a slide here on CBN. Yeah, thank you very much for that. So you can see from what we were talking about earlier, these terpenes are really what's key to being able to help you get back to sleep. And I think that's something that a lot of people say, well, I'm looking for a strain or I'm looking for a cannabinoid. Start with the terpene profile and then pay attention to the cannabinoids. The cannabinoids are important. They work with the terpenes, but I think the terpene has to be there to be able to make it effective. Now, what's nice about something like CBN is it addresses the receptors that pretty much help you get to sleep. And it's actually formatted or made when THC itself ages. So it's something that is so we had a question I know coming up, does THC help with sleep? The answer is yes, but when it's something in forms like aged CBN, which is where THC is, it helps quite a bit. I know that one of the things that can help with insomnia is also CBD. Now, Dr. Holt, you've seen that happen as well. The CBD is also very effective.
It's effective, yes. And arthritis pain is true. And that's one of the kind of things that we can see on brainwave activity at night is pain from arthritis is still influencing how your brain neurons inside your brain are trying to relax. So try everything to manage the pain before you go to bed. If your physician has prescribed stuff, even CBD, cannabinoids, things like that, make sure it's before bed so it can last through the night.
And you can find obviously CBN in a number of CBD products as well. There's a lot of good medical benefits from it. And yes, it will actually help you get to sleep. It'll help with neuropathy. It'll help with arthritis. And again, I'm going to go back to mentioning, pay attention to the terpene profile, because that terpene profile, even if the product isn't high in CBN, that will help you fall asleep. And again, you can ask for the certificate of analysis. You can see here where we've got, for example, beta-caryophyllene, myrcene is great. Linalool is almost a natural. And then you can also see that pinene works to help relieve the stress and anxiety. But again, be careful, because if you have PTS or you have memory issues, that comes into play. And it's something that those three terpenes right there can help you get some sleep and help you move forward. It's there. So pay attention to that. That's probably more important than the actual cannabinoid itself. Although CBN is great, and I think I'll recommend that and definitely head in that direction. Is there something I can do with cannabis to help with Parkinson's sleep deprivation, but not be groggy waking up? And I think this goes back to using a lot of CBN. I know that CBD products. If you're using CBD products, they typically will help you relieve a lot of that sleep deprivation and help you fall asleep, but it doesn't have that foggy hangover that THC has. Your thoughts on that, Dr. Gray?
Yeah, and that's been a reported side effect with almost all the studies, is the hangover effect that happens in the morning with CBD or THC products. It's still a dose dependent kind of thing. You can try to scale back on what you're trying to see if you don't wake up with it. But in the end, it's going to be quality sleep that you have and see how you feel during the day. But the Parkinson's disease thrown on top of it, sorry to hear, but it throws another variable into it that's hard to control for.
Sure. But I know the CBD is very good for Parkinson's. You still need a little bit of THC. In other words, it's not CBD, it's pure CBD. You need to have what they call you need just a touch of THC in it to really activate it or boost it to really help with that particular condition. Let's jump into the next question. Can I qualify for a medical marijuana card just for sleep problems? This really depends on two things. One is it depends on the state that you're in, first of all. Each state has different qualifying conditions. But in most states, you have a situation where the doctor can actually recommend a medical marijuana card if you have a condition that's close to one of the qualifying conditions. Really, it's up to your doctor if you qualify for a medical marijuana card or not. And the doctors that I work with do give medical marijuana cards if you have sleep problems. So it's something to take a look at. It falls under that debilitating condition category down here, because if you're not getting sleep, you're going to cause damage to your body. Is that correct, Dr. Holt?
Absolutely. And keep in mind that a lot of times sleep related problems like insomnia go along as a side effect with any of those disease profiles on the side of the screen right there. So it could be that could be going on, and then you have a sleep related problem. But everyone, including me, would focus on sleep hygiene issues if you walked in looking for a medical marijuana card for occasional sleep onset insomnia.
Let's jump into the next question. Lee, what do we have here for the next question? Can cannabis help with restless leg syndrome caused by antidepressants? We talked about cannabis helping with restless leg syndrome. How do antidepressants affect that, Dr. Holt?
Oh, they can spike them. Yeah, I've seen periodic limb movements in sleep just shoot up with antidepressants, but cannabis can help in my mind, but that would be only what I'm thinking, and it's not by the literature. So I couldn't say definitively, or you got a better chance at this, but I would say yes, that they could help because of RLS symptoms increased by antidepressants.
Next question is a good question. What low THC products do you recommend for insomnia? I'm sensitive to THC. I don't know the state you're in and the dispensaries that are available to you, but I do know that if you use a high CBD, low THC product, it will help quite a bit. Now, how do you know it's a high CBD, so THC product? You'll hear about these things called ratios. They'll say this product is a 1-to-1, or it is an 8-to-1, or it is a 1-to-8, or 4-to-1. The first number that you hear, like that 4-to-1, means 4 parts CBD. Second one is THC to 1 part THC. I would recommend a minimum of 4-to-1. And there are products that are higher than that. There are 8-to-1s, there are 12-to-1s, there's 20-to-1 products that you may want to take a look at. And again, because every person's body is different, what you want to do is you want to try maybe 1 or 2 products to find out what ratio is best for you. I know that my wife has found that a 9-to-1 works very well for her. And sometimes during the day, a 4-to-1 works even better. But if you're sensitive to THC, pay attention to ratio products, get a high CBD ratio, and that could help you quite a bit. And that'll actually help you with insomnia, because CBD does help you with sleep. Is that correct, Dr. Holt?
Yes, that's exactly what I would try. I would try that first, try all the sleep hygiene things to make sure you're doing everything right, and then look at it that way.
Mm-hmm. Now, let's jump on to the next question. It says, I smoke indica and take capsules to try to fall asleep each night. Is there any one strong dose dose of something I can take instead? I want to step back for a moment and have the audience understand what's really key is the terpene profile. Because if you get the terpene profile right, it'll work. Now, you said a couple of things here, and that is that the indica, today what they're doing is they're making indica leaning products. And those indica leaning products tend to be more, have a lot of CBD in them, or have higher ratio, have that high ratio, that 4-to-1, that 8-to-1, or whatever. Capsules, I'm going to mention that, take a while to work. As we showed in the graphic, a capsule could take 2 hours to work. So if you're trying to fall asleep, if you're going to take a capsule, take it 2 hours before you're going to go to sleep, because that's probably when it's going to probably kick in. If you feel that you can take a capsule and want to fall asleep in 15 or 20 minutes, may not happen because of your body, is what I'm trying to point out. I think the best way, is there a strong dosage? Again, it depends on you. Cannabis can be biphasic, and that's why it's important for everyone to try a little bit of cannabis, start low and go slow. If you're taking tincture drops, take a quarter of a drop, then maybe go to a half an eyedropper, maybe 3/4 of an eyedropper. Do each of those regimes a day or two, and you'll begin to feel the difference. Your body will tell you when you're hitting what they call that therapeutic dosing level, that one that's right here in the middle that you see in here. When that happens, you'll feel it. You'll know it. Your body will tell you. Doctor's not going to tell you, and third party like myself really isn't going to tell you. Your body will tell you. But what you're also going to find when you, let's say you go to half an eyedropper or three-quarters of an eyedropper, you'll find if you take more than that, you may begin to not feel as well. You may not feel just right. You may not just, you may feel just, you may just get some side effects that don't make you feel comfortable. Back down. You're, again, being biphasic, cannabis can work for you and it can work against you. So that's where you're going to get back to that middle ground out here. You see this big dot out here. That's your therapeutic dosing level. That's really, really important. We do a video, and we have a video in our library on dosing, and I suggest people watch that because it'll help quite a bit. But cannabis is so individualized that you really need to be able to know what your body likes, what it doesn't like, and really your body will tell you when you're in the right zone or not. Dr. Holt, any thoughts you have on this?
Oh, absolutely. I mean, judging by the question, I would say that you're almost trying to dare the medicine to put you to sleep. And that's not the way it goes. It really is like being ready to sleep. No naps, have enough sleep pressure built up to fall asleep naturally, and being on the backside of the circadian rhythm. Those two things have to match up, with sunlight for the circadian phasing and sleep pressure built up during the day to fall asleep naturally. Medical marijuana is supposed to just push you over the edge, not knock you out like a sledgehammer. And it seems like that you're trying to make it work by asking for something stronger to like put you out, and that's not the way. It's really not the way.
That's there. Next question is a good question. I need to sleep for 4 hours and then get up, so it needs to kick in immediately. What product or route of administration? Well, this is where potentially this is where a vape or something like that would help, something that works immediately. In other words, when you use a vape pen or you use a flower, it'll work right away. And that's probably a better route of administration to help you right away. And I think something that has at least a 1-to-1 ratio of THC to CBD will probably help. That's a good recommendation if you want to take a product, a vape product, and then have it work right now, work for you right now. Again, pay attention to the fact that flower vape products have a route of administration working, or a onset of about 2 to 4 hours. Your thoughts on that, Dr. Holton?
Well, I would say that if during the week, if you sleep more than 8 hours on a couple of days, then this 4 hours a night and having to get up because you have to perform is the wrong way to go. You're going against yourself. You're trying to like catch up. And if you catch up with sleep, then there is a lot wrong with that. So look at the way you're doing things. Remember that whole idea about between 8 hours of sleep, 4 hours to 12 hours. Everybody's doing pretty good. Less than 4 hours, more than 12 hours a night of sleep, they're dying faster than guys at 8 hours. So you may be a short sleeper, but if there are nights that you sleep way more than 4 hours, then there's something wrong with that.
Sure. Okay, next question is, what is recommended to calm slow brain activity to get sleep? Indica is, in general, does not work for me. Don't take the munchies, or don't want the munchies either. Your thoughts on that, Dr. Holt? How do you slow the brain down to get some sleep?
Slowing brainwave activity, it's the idea of like making sure that you've answered all the questions that you have during the day. Everything that's considered a stressor to you that would get you to ruminate over things that are going wrong, you answer them during the day, you write them down. Just don't answer them in your head. Physically write down the problems that you see before you go to bed. And if indica doesn't work for you, then it could be a paradoxical effect, or it could just be that it just doesn't work. So it's having an effect on you because I see that it does make you want to like eat something. So there is more sleep hygiene issues that I see, but I would try different species of indica because that is the broad range, and try different profiles for sure.
Right. And I also found that one of the things that helps me is music. I know that the calming music, things that help me slow down. I know that you hit the nail on the head, Dr. Holt, about, get rid of all those questions and get those things that are bothering you. Just write them down and save them for tomorrow. But then once you get into a mode where you just want to calm down, you want to just think about that that sea of calmness coming over you that helps you adjust and manage your brain waves. I think that people talk about meditation. You don't need to go into full meditation, but you just got to do something that just relaxes you and gets you to calm down. I think that helps quite a bit. You've seen people be able to do that, haven't you?
And the whole idea, about like putting yourself in that comfortable spot is a great idea. Dim lights, sometimes white noise with like a box fan running. So it creates that kind of like a nonsense noise in your brain because your brain is picking up all kinds of signals. It can't be perfect silence because you're waiting for something to disturb that perfect silence. So putting yourself in the weeds for all of that is a good idea to try to get to sleep.
Jump into the next question. It says, I let my registry, my medical marijuana card expire, and now I'm having trouble getting a new one. I think if you go to a licensed medical marijuana clinic where it has a doctor, he should be able to re-register you and actually get you back into the system. Now, I think the issue becomes every time you go to the doctor, the reason that these medical marijuana programs set up by the states are set up is they want to make sure that you have a condition that matches their program to be able to be there, and then also to make sure your dosing is correct. So you may want to talk to a couple of, or a well-known clinic. I recommend MMTC of Florida. They do a great job they have 25 clinics throughout Florida. They do a great job of helping the patient not only get their card, but after you get the card, they have a number of email journeys and things and videos like this. They sponsor these particular videos so that you can actually get information to help you with your medical cannabis journey and to help you go forward. So you can get a card. You should not have a problem getting a card. But what you want to do is you have to basically, as you know, when you get a card every 6 months, you got to re-up it. You got to go through that re-upping process one more time. That can help right away. So again, MMTC of Florida, mmtcfl.com can help you with that particular issue. Lee, you got some other questions that are here? These are some of the questions that were asked, live questions. Karen asked, does THC help with sleep apnea? The answer is yes. Dr. Holt, your comments on that?
Yes, it does. If it's REM-dependent sleep apnea, because THC resembles the tricyclic amine molecule, we've used those in the past, like protriptyline, to suppress REM sleep apnea because it suppresses REM sleep. Do I think it's the right thing to do? No. I don't think it's the right thing to do to like suppress like a stage of sleep you need for psychological health to stop apnea. The idea behind sleep apnea and REM is when we're dreaming, we are all paralyzed normally, so we don't act out our dreams. But we also lose like muscle tone to our upper airway. Our airway can collapse faster in REM sleep, and we have issues. We have decreased dream state sleep, or we have bad dreams, like someone's chasing us, someone's trying to run us down, and you're lost, all of those things because you can't breathe and your brain's trying to make sense out of that by saying, what does that feel like? And that turns into all of those bad dreams.
Yeah, I think so. The answer is yes, it does help with sleep apnea.
It is yes, but a not right yes.
Yeah, exactly. That's what I was going to say. It's a good point. Next question is leaf cannabis or flower more effective in helping achieve rapid sleep than a gummy form? The answer is yes. Gummies can take probably anywhere between 15 minutes to 2 hours, where flower works right away. I think that if you're looking at rapidly falling asleep, in other words, that onset, that's where flower works. I think if you're looking at staying asleep, that's where your gummy works. Is that safe to say, Dr. Holt?
Absolutely. Either the flower or vape. I think the vape pen is even faster in flower, but it's only like seconds.
Now, let's jump into the next question. It says, I've been diagnosed with PTS by the VA and suffer from insomnia for the last few years in particular. What type of medical cannabis would you recommend for me? And I'm going to go back to mentioning again, it's not a matter of just the cannabis strain. It's a matter of making sure the terpene profile is correct. And then also that you have a route of administration that you're comfortable with. When you're talking to, and you're looking at using medical cannabis, in your particular case, because you have PTS, I would steer clear of some pinene, but definitely pay attention to the other terpenes that we talked about, the beta-caryophyllines, the myrcenes, and the linalols. Those will help you quite a bit. Now, what type of cannabis is what you're comfortable with and what works for you. what your objective is. Do you want to fall asleep right away? Do you want to stay asleep? By the way, you can smoke cannabis to fall asleep. By the way, take an edible, have cannabis help you fall asleep, and then it kicks in while you're asleep and keep you sleeping through the night. A lot of people do that at bedtime. Your thoughts on this question, Dr. Holt?
Well, the VA is trying everything to help veterans with PTSD. I agree with that. But they have tried things like service animals, bowling, just ridiculous stuff. So they found conflicting results with use of like cannabis on PTSD. And that's where that individualized approach that you and I have been talking about, Mark, keeps coming in, that they have not looked at that and they have not tried that. So for this questioner, I would say you go into a licensed facility with people that know what they're talking about, and you go in there with that table of terpene profiles that we had up there earlier, and you check off the ones that you tried, and you try different ones until you find the one that works with you. Don't just like physicians to say that, this is it. You just get CBD, 300 milligrams, and you're good to go. You get 15% THC. If you're in Texas, you don't get that. You get like 3% THC or less than that. You have to know what you're taking. You have to write it down, and you have to try different things to see what fits for you. But yes, I do believe it fits you if you don't have trouble with insomnia, that you can fix by looking at that sleep hygiene profile and ruling out other sleeping disorders like obstructive sleep apnea.
I can't emphasize enough the individualization that cannabis has. Again, like coffee, like alcohol, your body will tell you what works and what doesn't work. Don't be afraid to try it. Don't be afraid to try different things, and also get the dosing correct. If there's one thing that drives me crazy with all these studies is they don't pay attention to the right dosing that people need to be able to address that particular condition. And I think that's important to make sure. It has a lot to do with the outcome of that study as well. So let's jump into the next question. Can you discuss transdermal patches? I am a huge fan of transdermal patches. I wear a transdermal patch. I use them on many occasions. Transdermal patches are patches that you can put on. And what they do is they give you a little bit of cannabis. They microdose during the day. Some of them last for 8 hours. Some of them will last for as long as 72 hours. But the point is, you're getting that little bit of cannabis that you need during the day to help you quite a bit. And especially if you're traveling, you're working or something like that, transdermal patches are great. I'm a huge fan of it. Your thoughts on this, Dr. Holt?
Yeah, absolutely. They use other medications the same way. They take a sticky patch and they put like a tube of toothpaste, stretch out a certain line of medication, and then they stick it to you. And you wait for that capillary to like take it up. Blood flow takes up the drug, and then there is a diffusion of the drug away from the capillaries into the tissues where you have the intended effect.
Transdermal patches are great, but again, they will last. Each patch has its own duration. So they'll last between 8 to 72 hours, and they'll take between 5 minutes to maybe an hour to work. But I'm a huge fan of transdermal patches. Let's jump into the next question, and is how do edibles help people? This is a very good question, because edibles are something that when you take that edible, it goes into your stomach and it's absorbed into your stomach lining. What happens is that by that process converts the delta 9 in the product to delta 11 hydroxy delta 11, which is a more powerful version of THC, and it helps people be able to get more medical effect. Now, edibles where they help people is being able to fall asleep, or better yet, stay asleep when you fall asleep. That's the main help that I find that edibles have for a lot of folks. You got to be very careful. You don't want to take too many of them, but they will definitely help with that particular area. What they won't do is it won't help you fall asleep. Your thoughts on that, Dr. Holt?
Yeah, absolutely. Yeah, wake after sleep onset. You need something that has like a slow release, and a lot of medications do that kind of thing. So this is another kind of way that they have to like say this will help keep you asleep. It's not a end all. It's not going to like for sure keep you asleep, but it will help keep you asleep. And the other ideas of delivery will help get you to sleep.
Right. I should mention that we're going to be doing a edibles webinar in 2 weeks. You might want to tune in for that. That'll help answer that question. But in the meantime, here's a link. Here's a bit.ly link. It's to our YouTube channel, Marijuana Aware, that has a whole discussion about edibles that can help you quite a bit. And I suggest taking a look at that. That might be able to give you a lot more information on this particular subject. Now, the next question is an interesting one. Dr. Holt, I'm going to need your help on this one. I have cirrhosis of the liver. What is the best administration route for this condition? And also, I have been diagnosed in the past with obstructed sleep apnea. I was never able to adapt to the CPAP machines. I have a new sleep study being performed in 2 days. Any recommendations due to your background in both fields? I also recently suffered a major seizure after not having seizures for over 40 years. Dr. Holt, this has a number of different issues in it. I think this kind of falls into your realm.
Well, there is an increase of like heart attacks, strokes, and seizures with untreated sleep apnea. First, it would be like how bad is the sleep apnea that they diagnosed you with? If it's less than 5 respiratory events in an hour, it's normal. If it's more than 30 events in an hour, then it's severe. So if you have severe untreated sleep apnea, very bad, you need to do something about that. And the first thing I could say is to always sleep sitting up. It's safer. You keep the weight of the abdomen off of your diaphragm, and you help hold your airway open. So sleep sitting up if you're not being treated. The problem with CPAP machines, if you wear it, it works. That's the idea. It will stop the sleep apnea, will reduce the risk of heart attack, strokes, and accidents. But you have to wear it. So try to find a different person to help fit you with a mask, and try to find somebody that knows what they're doing with the machine. If you weigh over 250 pounds, you may need a different type of mode of delivering that pressure, like BiPAP, or something else like that, bi-level positive airway pressure. But cirrhosis of the liver, the condition suggests what's been going on in your history. I'm not sure, but I would guess. And the idea is like that. One thing for sure is that if there is any kind of like alcohol intake, that you will get to sleep faster, you will get to deeper sleep. But as soon as your liver that is not doing too well is starting to metabolize the alcohol, you will wake up a lot faster and more frequently during the night, and will feel fatigued and horrible during the day. Sure. So stop that if that's what's going on. And find somebody very good at delivering like positive pressure therapy to you with the obstructive sleep apnea. Always sleep sitting up if you're not being treated with a untreated sleep apnea, please.
Right. And I think when they talk about the best route of administration, I think a tincture drop would work better. In other words, edibles go into your stomach, get into your liver. I think if you can use a tincture drop, I think that would help you absorb cannabis into your body a little easier, wouldn't it?
Yes, but don't take anything as a sleep aid without being treated for the obstructive airway. Very dangerous, not a good thing to do. Treat the obstructive airway first and think about like getting to sleep naturally, because if you fall asleep better and you breathe free and clear during the night, you may be sleeping perfectly fine without anything to help get you to sleep. That's what I've always found.
Right. Well, I hope that helps answer your question. Dr. Holt, we've covered a lot of questions and a large topic of sleep. Do you have any final thoughts?
Well, the only thing that I've heard in the last 6 months or so is a new drug delivery method, nanoparticles, that they're looking for all medications. They're also looking at it for CBD, is to like put certain doses of this into a fat covered like little circle. And these things are only like 1 micron long. A red blood cell, a single red blood cell, is 7 microns long. So these are very small particles that contain the drug, and they will like last possibly through the liver. so they're not metabolized so fast. They may get to the site where they're needed without being broken down so fast. So these are ways to protect the medication to get to the site where they wanted to. So it's something that's coming out with CBD and that I read about, and I think it's a good way to look at it.
Well, Dr. Holt, could you maybe send me and send us some at least an article or something on it that we can pass on to folks? I'm very fascinated by that subject, and I'd like to talk to you besides this webinar. I'd like to talk to you more about it. I'd like to understand that, because that seems like it has a lot of promise. What we want to be able to do is provide more information about your conditions, how to use medical cannabis, and what works. And please feel free to tune into that. So I hope everybody has a good week, good weekend, and more importantly, can get some sleep. So hopefully this helps. Dr. Holt, thank you, and everybody, thank you very much for joining us.